for you.
Okay, thank you.
Sugar?
Yeah, a little bit. Just 1 spoon. Yeah.
معلقة
Malawi. Malawi. So hello everyone. I'm actually in Cairo, Egypt. I came here, and I'm staying at the Karim place because we studied actually together. Well, not in a time, but we actually went to the same university. Where did we study?
So I studied in the BSO, but many
Oh,
years.
what's your name?
But many years after you. So my name is Karim. That's my first name. Arabi is my last name, and I'm Egyptian. And I went to England to study osteopathy in the same school as UG studied. So the Bridge School of Osteopathy, which is now the University College of Osteopathy in London. And he studied many years before me, so he's more expert in osteopathy than
I'm the old one. You were a little
he's
bit
the
young.
wiser version of osteopathy.
No, it's not that.
I'm the new version of osteopathy.
Yeah. And who do I have here, the gentleman?
I'm Dr. Mafdi. I'm a physiotherapist and rehabilitation specialist here in the clinic with Dr. Karim.
Uh-huh. So I suppose this is your clinic right next to it, is it?
Yes, it is. It is.
Yeah. It's pretty nice, you know. But you have got a beautiful plants and you have got a place to chill out. And yeah, as soon as I sit down here, the gentleman brought the water.
Yes.
That's fantastic.
Coffee's coming as well.
Oh, what coffee is that? Is that an Egyptian coffee?
It's Egyptian coffee.
Yeah.
Definitely.
Okay.
And we appreciate having a little garden in the entrance because it gives more comfort to clients to come and sit down and just enjoy some time before the session. Just relax a little bit from the stress of the streets. So that when they come in, they're not stressed as you might see in the clinic, in your clinic. And what we do here is our small practice appreciates the multidisciplinary action for the patient. So combined osteopathy for treatment of managing pain and the issue, whether mechanically or non-mechanical, and then followed by strengthening and followed by rehabilitation, guided exercises, and then self exercises to the client. That empowers the patient to his own well-being afterwards, not just for the treatment time, but throughout his life, so that he would know what to do and what not to do. He would know what exercises he needs to do on a regular basis to strengthen certain areas according to their daily activities. So someone who's sitting for a long time, he will need strengthening areas more than areas. So the combination between osteopathy and physio is very important from my perspective.
I believe in that as well, because today what we see actually also Tokyo Olympics, also the London Olympics, that was before that, there was the Rio, all that the Olympic Games, we have seen combination of so this the department called physical therapies. Within us physical therapies, we have got a physical therapist, we have got a chiropractor, and osteopathy. So and they are working with the doctors, and also nurses, and a pharmacist, podiatrist. They are basically multidisciplinary clinic. They are doing.
That's the dream here as well.
Yes, it is.
It is the dream here as well. I mean, whenever we find a practitioner that can come and join our team, we welcome this practitioner for sure.
Oh, that's fantastic.
Because the more we give to the patient needs multidisciplinary, course of action. One profession cannot help in everything.
That's right.
But the patient needs help from everyone to overcome his pain and difficulties. So and osteopathy is virgin in Egypt. So
that's pretty brand new.
Yeah. So we're educating people as well as part of the process of what is osteopathy and what can we help with, what's the scope of practice, And then comes Dr. Mafdi with his physiotherapy and rehabilitation part, which he can explain.
So, do you actually work first to the patient or the before the his work? How does it work here?
Usually, after the patient comes and we get to the diagnosis, and Dr. Karim works with him with his osteopathy knowledge and his osteopathic technique. Then after he is pain-free, we move to the next step, which is physio and rehabilitation. Sometimes when the patient doesn't need osteopathy, he goes directly to the physio and the rehabilitation. We design a program for each patient according to his status, his complaint, his work, his working atmosphere. So he could make the exercise not even at the gym, but he can make the exercise with the coffee.
Yeah. Oh, fantastic. Shukran. Well, I'm sorry, I don't have that coffee
okay.
for you, but can I try the first taste because I've been waiting for that so
sure.
many times.
Go ahead.
Yeah, this is, by the way, this is a coffee that's not a normal coffee in Europe or Japan. This is something, let's say, it is the manner of the Turkish coffee with the cardamom. Is that how, with the sugar? So I understood. Is that a right thing? Is it okay?
It is, yes.
Yeah. But how do you call this one?
And a lot stronger.
Aha. So I'll taste it first. Oh yeah, that's really strong. And
It is really strong.
But it's kind of like refreshing at the same time.
Yes.
Yes, that's the way I like it.
It wakes up the mind and senses.
Yeah. But it doesn't make me any crazy, so it's good.
Well, not after your first.
Well, when you have a second, third, then I might be getting crazy.
We'll see.
Yeah.
The day is long.
So basically, you're telling me that after the Karim works and you work on a rehabilitation as soon as the pain gets free.
Yes.
How important for you that patients get pain free? Is it important for you?
In most of the cases, it's very important before starting the rehabilitation.
Yeah.
Because we will start working out the muscles and strengthen them and activating the important muscles that works best for him and keep everything in place. What Dr. Karim have done with the patient, we have to stabilize everything so he won't have to come over again and again. So the rehabilitation main goal is to stabilize everything in place with strengthening to specific muscles that everybody needs. Everybody is different from another according to his his job and his movement all around the day or activity in the daily living.
Fantastic. Sounds really, really good to me. You know, where I grew up is actually in Japan. And this kind of relationship has started since, let's say, it's also brand new. Since actually I haven't been to the actually Tokyo 2020 or 2021, but I've heard from one of the osteopath who worked in Tokyo 2020, just telling me that this is really the first time that actually osteopathy and physical therapy working together. So in that moment, as after the game, during the game, physical therapy, they learn. They know some of them. By the way, they do that. The manual therapy and all that. But when it's specializing and it's according to demanding by the athletes. Some athletes, for example, they are requesting for the chiropractic or osteopathy. So there's now someone say, hey, I'm running 100 meters. By the way, I've got my pain on the left knee. Okay, but normally I see that chiropractor. Can I have a chiropractor, please? Or, well, I've seen that osteopathy all the time. So instead of the chiropractor, I'd like to have the osteopathy or physical therapy. Well, because my country, we have a lot of physical therapy, and I trusted in the physical therapist. So can I have a physical therapist on the game when they get injured or they are out of the balance or out of the conditions? We try to basically helping, giving offer to the athletes who are requesting whatever we needed, and I find it is really quite nice.
Yes, exactly.
And then one part, you are actually demonstrating that in this practice. How do you call it, this practice, by the way?
This
Yeah, your practice.
this is osteopathy clinic,
Okay, this is what you call.
but it's SWNW osteopathy, which is Sunu, and there is a story behind the name. So go to the website and check it out. But
Okay.
Suno
Okay.
means doctor in hieroglyphic language. So in
Uh-huh.
ancient Egyptian language, Sunu means doctor. So
I see.
Sunu osteopathy means doctor of osteopathy.
Uh-huh.
So basically, yeah. So go to the website, check this.
Okay. Okay.
You'll enjoy it. It's a nice read.
Excellent.
It's a nice read.
Well, and I know that when you graduated my school, and in case if I want to send someone that I know in Cairo, that will be totally to you.
Sure.
That's
That's a
because
pleasure.
we believe in the same philosophy, and the technique is probably the button bread for us. And I know how you've been trained because I trusted it in our university.
Hopefully.
Yes. Oh, that's fantastic. Shukran. So yeah, I think that's then with combining with the physical therapy, I think it's fantastic.
Yes, it is.
Yeah. I mean, okay, I'd like to ask you something question. Ask you a physical therapist. What is really difference between because osteopathy and physical therapy, we are working all with the hands.
Yes.
Yeah, that's the same thing. We have learned same anatomy, physiology. We learn everything basically very close. But what is makes a difference between your physical therapy and his osteopathy? What is the difference?
Okay, I have been working with Dr. Karim since 2019. What I have witnessed while working with the patients,
Yeah.
that osteopathic have deeper knowledge. When something is related to the visceral issues, something related to fascia. Sometimes physical therapy doesn't work for people, so they go to the osteopathy, and sometimes that osteopathy doesn't work, so they go to the physical therapy. So I think they both complete each other, and the most important thing here is the patient. So we have to look for what's the issue with the patient,
Mhm.
and sometimes the osteopathy have issues that they can deal with. We as a physiotherapist, we can't deal with,
Mhm.
because they have more knowledge related, as I said, to the fascia and the cranial stuff and all these things. We don't have it back in school as a
I see,
physiotherapist,
I see.
but we work more with the muscles and nerves issue and the rehabilitation and with common problems with the patients.
I see. That's really good to know because some people, especially the patients, sometimes they don't know what is the difference. So thank you very much for the information.
Thank you.
I think the patient is not responsible to know the difference between professions. I think we professionals are responsible
Mm.
to tell the patient what is in our scope of practice, what can we help with, and what needs other professions to help with. The patient should. It's good that you have a patient who is educated enough to know the difference,
Mm.
but it's not their responsibility. Their responsibility is their own pain journey. But our responsibility as practitioners is to explain what can we help with, what other profession needs to come in to help to complete the picture of their pain journey. So basically, we are more responsible than the patient to know what's the difference between the professions and what's the scope of practice between a profession and another, so that I would refer to you, even if between the same profession, like an osteopath and an osteopath. If I know that you're much stronger than me when it comes to shoulder issues, or when it comes to shoulder in the context of the whole structure, I would send the patient to you, because the most important person now is the one in pain. So I should be more responsible in directing the patient to what really is going to help, even if it's someone else in the same profession more than me. Because so we are more responsible, basically.
That's right. I really believe in that too.
So I think.
You know, I've got something burning question. I try to be.
If it's burning, it might be something nerve.
Yeah, that might be my brain is maybe there's something wrong with my nerves, but I still haven't got my
the
question.
coffee is working now.
Yeah, it is working now.
The coffee has started working.
It's fantastic. Yeah, now starts, my brain's working.
But please do tell, what's the
Okay.
burning question?
Yes, because Cairo, then Egypt, and I assume that majority of the believing is in Islam. So in that case, I know that the person who believe in Islam is the Muslim. Is that how I understand? Is that okay?
Yes.
Okay. So that Muslim person also respect, the lady and man. Of course, I went through. I've been here the 2 days in Cairo, and I learned that I have to be really careful with how I with my hand. With the Karim, I can do that. Hey, how are you? That's okay. But I can't if you're the lady, I have to be really careful.
Yeah.
In that sense, I start imagining, okay, what would be if I am the osteopath, male osteopath? And for example, let's play the role. Sorry, I know you are a good man, but please play that, lady.
No,
role.
I can play it.
Yes. So I am the osteopath, the male osteopath, and then you're the lady. How does it work?
Well, first of all, I'd just like to mention that, especially in Egypt, assumably there is greater numbers of Muslim followers than Christians, for example.
Yeah.
However, this is not a religion thing at all.
Okay.
This is just the customs and traditions of a whole country, of all the citizens, regardless their religion. So basically, if it's respected not to touch a woman unless you're permitted. Not because of a religious beliefs, it's because of traditional beliefs. So it's something more traditional than religious. It has nothing to do religiously. When it comes to traditions, it is respected, because I have almost 80% of my clients are female, are women. So they respect that if you can help them, they need your help. So it doesn't really matter. However, there will be some men that doesn't want me to touch them.
Okay.
There will be some women that doesn't want me to touch them. So in that sense, we try to help out by assigning a female or a lady osteopath or physiotherapist to help her, or help him, because that's if he's more comfortable dealing with a lady than a man. But work is work, and we've got to respect the patient and the patient desires, regardless what we think is right. We offer the experience, we offer the knowledge, we offer the choices, and the plan of treatment is the patient's own decision.
I see. So
we try to facilitate everything as much as we can.
It is totally up to that lady's permission. If you have a permission authorization, then you'll be able to, offer you what you can do.
Yes.
And is this the same for the physical therapy as well? If the lady comes to to you and she needs your help, then with her permission, you'll be able to treat.
without her permission, I cannot work because this is the ethics of the physical therapy here in our clinic. We have to respect the patient believes whatever he believes in, even he's a Muslim or Christian or whatever he believes, we have to respect, or even the traditions we have to respect. So I get a consent from him that I am able to touch him, or if he doesn't want or he doesn't allow me, so I would refer him to a female physiotherapist. I have to respect his willingness.
Ah, I see. So if there's no permission, then this is another option, is the lady female
Yes.
therapist. Gotcha.
I mean, coming from a Muslim background, and Dr. Mafdi is actually from a Christian background.
Ah, okay. Are you?
Yes, we're working together, and we haven't had any issues.
That is so cool.
We've been partners for since for 4 years now, and everything is going smoothly. So it's really not about religion at all. It's about the country traditions, which is respected in any country. So we try to respect people's, because we have many expats and many foreigners and diplomats that comes here, and everyone comes from a different country with different traditions. So if we ask them what they prefer, and if they have any special requirements, we are happy to comply and help as much as we can within their traditions and what they prefer. Even if it's out of their tradition, but they prefer something different, we will try to provide that as much as we can. They are the ones in pain. They are the ones that need help.
That's right. That means that we are the all patient-centered, center orientated, and this we are the hand for the help.
Definitely.
Okay, so if the lady is here, I mean, or the patient's there, and we are helping, right? That's what we're doing.
That's exactly.
Excellent. I think there was something really worth to hear that, actually, because I never addressed this kind of question. Anyone, of course, my university had I assumed that there was someone believing in Islam, but I never asked this question. So I was so glad that I asked that I actually did that question. Yeah. So I suppose that was a pretty good conversation for me, and I hope that the listener of this, or the watch, how do you call that?
The viewers.
Viewers. I was gonna say in German, the Zuschauer. It's not, that's wrong.
Zuschauer auch.
Ja. Du kannst auch den Deutsch, oder?
Das auch Arbeit.
Yeah, this is top. Okay, also das war that is the end of the talk today. Thank you so much for the participation, and I still enjoy the Egyptian coffee. So until the next time.
Happy to see you all in Cairo. If you needed any osteopathy, let us know.
And also physical therapy.
Yes, of course. We're welcome here.
I'll put all the information on that.
Right.
Under
I hope my hair is fixed well in the video.
Oh, that's fantastic. I mean, you look always good, man.
Great.
Yeah.
Great.
Okay.
Thank you.
Okay. Bye now.
Bye bye.
Bye.